When we talk about Tadalafil, the vast majority of people immediately think of one specific thing: erections. It is the brand name synonymous with the weekend pill, and for years, it has been marketed almost exclusively as a solution for performance in the bedroom. But as a health educator, I need to tell you something very important that often gets lost in the marketing noise. Tadalafil is a systemic medication. It acts on the organism in a way that is much broader than people think. It doesn't just target one specific organ. It influences physiological pathways throughout the entire body. These effects can represent significant benefits in some very specific medical cases, but they also carry risks, especially when the use is done without proper guidance or understanding. In today's video, I am going to explain 5 benefits of Tadalafil that go far beyond the common understanding, exploring the science of how it actually impacts your physiology, your prostate health, and even your circulatory system. We are going to move beyond the bro science and get into the pharmacology. Let's start with the first benefit, which is actually the most famous one, but we need to understand why it happens. This is the improvement of erectile function. However, the mechanism here is widely misunderstood. Many people believe this is a magic switch that creates arousal, but physiologically, that is incorrect. Tadalafil belongs to a class of drugs known as PDE5 inhibitors. To understand this, you have to understand how an erection works mechanically. When you are stimulated, your body releases nitric oxide. This chemical signals the smooth muscles inside the blood vessels of the penis to relax. When they relax, they widen. This is vasodilation, allowing blood to rush in and get trapped, creating rigidity. Here is what Tadalafil does. It protects the chemical messenger that keeps those muscles relaxed. It prevents an enzyme in your body from breaking that messenger down too quickly. It amplifies the action of nitric oxide. Why is this distinction important? Because Tadalafil does not stimulate desire. It does not act on the brain to increase libido. It is strictly a hydraulic agent. It facilitates the body's physical response, but only when the biological trigger, the arousal, is already present. If the difficulty with erections is related purely to hormonal issues like low testosterone or severe lack of libido, the medication alone cannot solve the problem because the initial spark is missing. It helps the plumbing work, but it doesn't turn on the faucet. This leads us directly to the second benefit, which is perhaps the most significant differentiator of Tadalafil compared to other medications in its class, like sildenafil. This benefit is the duration of action. We often call Tadalafil the weekend pill for a reason. While other inhibitors might last for 4 to 6 hours, requiring you to time your medication very closely to when you plan to have intimacy, Tadalafil has a unique pharmacokinetic profile. It has a long half-life. It can remain active in the organism for up to 36 hours. Now, we need to clear up a massive misconception here. This does not mean that a person will have a continuous erection for 36 hours. That would be a condition called priapism, which is a medical emergency that requires a hospital visit. What the 36-hour window means is that the drug remains in your system, keeping that enzyme inhibited so that if and when stimulation occurs during that day-and-a-half period, the body can respond with much greater ease. For many patients, this offers a massive psychological benefit: spontaneity. It removes the pressure of the clock. You don't have to say, "Hold on, I need to take a pill," and wait 45 minutes. You can take it in the morning and go about your day. However, there is a trade-off that you must understand. Because the drug stays in your system longer, if you experience side effects, they also last longer. If you are prone to headaches, back pain, or indigestion from the medication, those symptoms might linger for that same 36-hour window. It is not necessarily weaker or stronger than other options. It is simply more sustained. This lingering discomfort is exactly why so many men are looking for a way to restore their natural function without relying on synthetic chemicals that just mask the symptoms. If you want to avoid those 36-hour side effects and actually target the root cause of the issue, you need to see a presentation about a bizarrely simple purple hardening tonic. It is a 7-second home remedy that is helping men revive their youthful hardness and stamina naturally, without the headaches or the pharmacy visits. Point your phone's camera at the QR code on the screen right now to watch the short video explaining how this works. I have also pinned a link to it at the top of the comments section below. It's worth checking out if you want to fix the biological root of the problem. Now, moving on to the third benefit, and this is one that many people are completely unaware of. This is extremely relevant from a clinical point of view. Tadalafil is frequently prescribed for patients who do not even have erectile dysfunction. It is an FDA-approved treatment for benign prostatic hyperplasia, or BPH. BPH is the non-cancerous enlargement of the prostate. As men age, the prostate gland grows and can squeeze the urethra, making it difficult to urinate. Remember how I said Tadalafil relaxes smooth muscle tissue? Well, it doesn't just do that in the blood vessels. It also relaxes the smooth muscle fibers in the prostate and the bladder neck. By relaxing these muscles, it reduces the resistance to the flow of urine. This can significantly improve symptoms like a weak stream, the difficulty in starting urination, the sensation of incomplete bladder emptying, and nocturia, the need to wake up multiple times during the night to use the bathroom. In many cases, a low daily dose of Tadalafil is prescribed specifically for this urinary relief. It treats the lower urinary tract symptoms effectively. This highlights that we are looking at a drug with real, broad therapeutic applications beyond just sexual performance. It improves the quality of daily life for men struggling with prostate issues, regardless of their sexual health status. Now, for the fourth benefit, we need to discuss something that is often controversial. This involves the concept of systemic vasodilation. As I mentioned, Tadalafil causes blood vessels to widen. This is responsible for many of the side effects, such as facial flushing, that redness and heat in the face, or nasal congestion, which happens because the tissues in the nose swell with increased blood flow. However, recently, we have seen a trend, particularly in fitness communities, of using Tadalafil as a pre-workout supplement to achieve better muscle pumps at the gym. We need to be very serious about this. Relying on a prescription medication for a cosmetic effect in the gym is a fundamental misunderstanding of pharmacology. While it is true that Tadalafil increases blood flow, using it for athletic performance is not medically supported and can be dangerous. When you exercise, your heart rate increases and your blood pressure dynamics change. Taking a powerful vasodilator can lead to unpredictable drops in blood pressure or hypotension. This can cause dizziness, fainting, or excessive stress on the cardiovascular system during heavy lifting. The benefit of vasodilation is meant to treat restricted blood flow in specific clinical conditions, not to make your veins look bigger in a mirror. Medication is not a supplement. The side effects, like palpitations or vision changes, are real risks. Using it to chase a pump is prioritizing vanity over cardiovascular safety. It is an off-label use that carries risks that most people do not calculate correctly. Finally, the fifth benefit. This is intangible but incredibly impactful. When properly indicated, Tadalafil can break the psychosomatic loop of performance anxiety. The sexual response is heavily dependent on the nervous system. When a man is anxious, worried about whether he will be able to perform, his body releases adrenaline. Adrenaline is a potent vasoconstrictor. It clamps blood vessels shut. It is the chemical opposite of an erection. This creates a vicious cycle. You worry you won't function, so you release adrenaline, which ensures you won't function, which makes you worry more next time. Because Tadalafil lowers the physiological threshold required to achieve an erection, it acts as a safety net. It ensures that even with some mild anxiety or adrenaline present, the physical response can still override the stress response. For many patients, this reliability restores confidence. Once they know the mechanics will work, the anxiety dissipates. Eventually, some patients find they no longer need the medication because the psychological block has been removed. It improves self-esteem and relationship dynamics. But we must be clear, this emotional benefit does not justify self-medication. If there is deep psychological suffering, clinical depression, or relationship toxicity, a pill cannot fix that. It is a tool to help the body, but it is not a cure for the mind. To wrap this up, Tadalafil is a fascinating compound. It improves blood flow mechanics, offers a long duration of action for spontaneity, treats prostate enlargement, and can help restore psychological confidence. But it is not a toy. It acts on your heart and your arteries. It is absolutely contraindicated for anyone taking nitrate medications for chest pain. Mixing these can cause a fatal drop in blood pressure. It requires caution for those with uncontrolled hypertension or history of stroke. It is a safe and effective drug when prescribed and monitored by a professional, but it can be dangerous when trivialized. Understanding what you are putting into your body is the first step toward true health.